Hello and welcome to sqadia.com. My name is Osama and today we are talking about hemodynamic dysfunction. This second part of this lecture is actually focused on thrombosis, thrombogenesis, and fibrinolysis. So what is thrombosis? It is actually the intravascular coagulation of blood. Because as we know, whenever blood stops moving, it starts to coagulate. But if this occurs even in the blood vessels, then this is known as intravascular coagulation, and it is also termed as thrombosis. It is predisposed, or the risk factors for thrombosis are conditions like venous stasis, which is very important because venous stasis usually occurs after a prolonged period of immobilization, such as after post-surgical immobilization in patients. Other risk factors include congestive heart failure, polycythemia, visceral malignancies, sickle cell disease, in which there is an abnormal structure of the red blood cells, oral contraceptives, and smoking. Now, how does thrombogenesis take place? What is thrombogenesis? It is actually the formation of the thrombus. The thrombogenesis results from the interaction of platelets, which are a type of blood cells, damaged endothelial cells, and coagulation cascade. So let's start off with the platelets. So what is the function of platelets in the first place? So platelets are part of the blood cells which are involved in maintaining the physical integrity of the endothelium. And what is endothelium? Endothelium is actually the lining of the blood vessels. Now, endothelial repair is actually also a function in which the platelets contribute by the platelet-derived growth factor. Platelets are also responsible for forming platelet plugs, as you can see here, whenever there is an endothelial injury, so that hemorrhage would not occur. They also promote the coagulation cascade through the phospholipid complex. And this coagulation cascade is actually one of the things which contributes to the formation of the thrombus. So, if we want to summarize the reaction involving the platelets, that how platelets respond in the formation of the thrombus, it can be simply divided into three distinct phases. One is the platelet deposition and adhesion in response to endothelial injury. The second is the secretion of different type of products by the platelets, followed by aggregation of the platelets in one place at the site of endothelial injury, which is also known as platelet aggregation. If we wish to look into detail, so let's look at the reaction or response of the platelets one by one. So first of all is the adhesion. So what happens is that whenever there is an injury, so there is an damage to the endothelial lining, resulting in the exposure of the subendothelial collagen, which leads to platelet adhesion, which means platelets adhere or bind to that. It is followed by a release reaction in which platelets release different type of chemical compounds such as adenosine diphosphate, histamine, serotonin, platelet-derived growth factor, and other platelet granule constituents. This is followed by activation of the coagulation cascade. And how does that work in the thrombus formation? We are going to discuss that in the coming slides. There's also an arachidonic acid metabolism in which arachidonic acid is converted into thromboxane A2, which is a potent vasoconstrictor. It is followed by platelet aggregation in which platelets start binding with each other or start to aggregate in one place at the site of endothelial injury. So aggregation along with recruitment of additional platelets from the circulation. The agonists that promote this procedure include adenosine diphosphate, which were actually released by the platelets themselves, thrombin, and as well as thromboxane A2, which was actually formed from the arachidonic acid. Other than that, there is stabilization of the platelet plug in which fibrinogen binds aggregated platelets together, and the platelet mass is bound by or stabilized by fibrin, which is a protein. At the end, there is limitation of platelet plug formation because it needs to be modulated, it needs to be controlled because it should not be excessive. So that is done by the endothelial prostacyclin PGI2, which is antagonistic to platelet thromboxane A2 and limits further platelet degradation. And that platelet thromboxane A2 was actually responsible for platelet aggregation, as we just saw here in this step. Now, the second type of contributors in the thrombus formation were endothelial cells. So what are endothelial cells? As I already mentioned, these are actually the lining of the blood vessels. So they are resistant to thrombogenic influence of platelets and coagulation proteins, which is also known as that they are thromboresistant, and their function is to modulate hemostasis. They produce heparin-like molecules such as endothelial proteoglycans, which activate antithrombin 3, as the name suggests, antithrombin. So it neutralizes, or it actually works as an antagonist to thrombin and other coagulation factors, thus preventing the formation of a thrombus. They also secrete tissue plasminogen activator and degrade adenosine diphosphate, which was also an activator of platelet aggregation. They also synthesize thrombomodulin, which binds to thrombin and converts it into an activator of protein C and protein S, which is a cofactor of activated protein C, playing a role in inhibiting coagulation. They also synthesize and release nitric oxide and PGI2, which we already studied, are actually antagonists to the formation of the thrombus. But that actually occurs only when there is a normal endothelial cells. But in case of injury in which the endothelial cells are damaged, that actually leads to the formation of the thrombus and platelet adhesion and aggregation and clot formation. The third component was the coagulation cascade, which has two pathways. It can be either via the intrinsic pathway or the extrinsic pathway. In the intrinsic pathway, the stimulus is, for example, injury to the blood vessels, and it starts off from the component 12, which is converted into component 12A, which stimulates the component 11 and converts into 11A, which stimulates the component 9 and converts into 9A. In this process, up till here, this was the intrinsic pathway. But in the extrinsic pathway, in which the stimulus is the tissue factors, for example, the component 8 is converted into component 8A, and this is the part from which the process becomes the same. So after this, the component 10 is converted into 10A, and then 5 into 5A, which actually results in the conversion of the prothrombin to thrombin. And what is thrombin? As we said, that it is actually an agonist for the formation of the thrombus. And it also results in the conversion of fibrinogen into the active form, which is the fibrin. And fibrin is actually what binds those aggregate of platelets together, and this actually results in cross-linking fibrin and clot formation. So that's how coagulation cascade plays its role in the thrombus formation. Now, whenever there is actually the formation of the thrombus, it should be modulated as well, because excess of everything is harmful. So there needs to be a very important phenomenon or process which is known as fibrinolysis. So it is actually concurrent with thrombogenesis, and it actually modulates coagulation by acting in antagonistic to the thrombogenesis. What happens is that it restores blood flow in vessels occluded by the thrombus and facilitates healing after inflammation or injury, because if the fibrinolysis does not occur or the process of thrombogenesis is not modulated, it can occlude the complete lumen of the blood vessel and result in ischemia and infarction into the areas to which that blood vessel was supplying the blood or nutrition. Plasminogen is actually converted into plasmin, which is actually a fibrinolytic protease. So similarly to fibrinogen, which was converted into fibrin, which was resulting in the formation of thrombus, plasmin is actually breaking that because it is fibrinolytic. And then, as I already mentioned, plasmin splits fibrin, and that's how fibrinolysis occurs. So in this part of the lecture, we talked about thrombus, thrombogenesis, and fibrinolysis. I hope you learned a few things about hemodynamic dysfunction and pathology, and please do remember to watch other parts of this lecture and keep on watching sqadia.com. Thank you.